Hey everyone, this is Molly. I chose to research the substance kratom for my project. Kratom is what is a green powder that comes from leaves of a tree native to Southeast Asia. Its fancy name is Mitragyna speciosa. It has been used for medicinal purposes in Southeastern Asian countries for centuries. Usually, this was used to combat fatigue and pain when working outside for long hours. It was first documented by Western scientists in 1839 by botanist Peter Willem Corthels. They named the tree after him, and so it's now called a Corthels tree, and you will sometimes hear kratom referred to as korth. So, in some countries, it's been determined that the risks of kratom use far outweigh any potential therapeutic uses for it. It's also criminalized in some European countries and Australia. It's become a substance of interest in the United States. It's sold and marketed here as a dietary supplement and an herbal supplement. You can buy kratom in gas stations. You can buy it in health food stores. You can order it online. They sell it in vape shops and smoke shops, what you would call a head shop, where they sell various smoking apparatuses and other kinds of things. Um, so, kratom is something that people use for pain management. They use it for management of opioid withdrawal, and there's definitely people who say that it's a safer alternative to using traditional opioid medication, and that it's also a form of harm reduction. However, kratom is used recreationally to get high like any other substance would be. So this little uh, picture down here in the corner says greenhorn kratom and redhorn kratom. Those are just two examples of things that are sold in local shops, vape stores. You can find all this stuff online. Um, it's easily accessible, even in states where it's banned. You can just order it and have it sent to your house. Um, So current research has definitely found that kratom has a high potential for abuse. And so despite the high potential for abuse, there's also a growing body of evidence that suggests that kratom can be used successfully as a form of harm reduction for management of opioid use disorder. So if you take kratom in small doses, it's going to have a stimulant-like effect, which is why when people used it when they were out working in fields, it was something they could take to keep them going for long hours. If you use it in higher doses, it creates opioid-like effects. So this may be why kratom was started to be used to mitigate the effects of opiate withdrawal symptoms. It's said to help minimize the symptoms, which is a very uncomfortable physical process. Um, the problem is there's no federal regulation of doses or content in what is sold in the United States. So even if it has a label, and there's no way to know what is actually in that little thing of powder or whatever capsule it might be, that it actually has a specific amount of kratom in it, and you don't know what the compounds are that are in it. Kratom has over 40 active alkaloids. There's 25 that are found to have analgesic effects, anti-inflammatory effects. The two main compounds in kratom that act as partial opioid agonists are mitragynine and 7-hydroxymitragynine. They both act as a partial opioid agonist on the mu receptors, which is very similar to how buprenorphine works. And they're also stronger agonist on the kappa receptors, which is similar to how morphine works. So right now you can find kratom sold in capsules, tinctures, powders, and leaf form. It's not a scheduled substance by the DEA, but it is on a list of particular substances of concern. So some research has looked at these compounds and said, okay, so if this is working like morphine, what does this mean for people using kratom, and are they going to experience withdrawal symptoms? And that's actually what the research has shown, is that if the compound has a high amount of the 7-hydroxymitragynine in it, then it actually produces cross tolerance for morphine. So the person would have tolerance for morphine if they were using that with a high dose. And then when they do go into kratom withdrawal, you can actually use naloxone on the person to incite precipitated withdrawal, which is the desired effect. So when they give naloxone to someone having an overdose from opioids, precipitated withdrawal is when it actually snaps them out of it immediately, and then they have immediate withdrawal symptoms. This is really concerning for a lot of different reasons, mostly because what's being sold in the United States is not labeled, and people literally don't know what they're taking, how it will affect them, especially if they're using other substances in conjunction with that. People take kratom for several different reasons. Um, one of the things is that kratom will get you high. You will experience euphoria. If you do the high dose of kratom, you can get the opioid effect of euphoria, having anxiety relief, relaxation. When you mix things with other substances, there's any number of combinations that you can experience. And so that is very appealing for someone who is actively using substances. And there's a few studies that have been done by physicians that treat patients with chronic pain on kratom. They've noted that it's definitely a substance that is problematic, but they also are willing to consider that maybe it could be beneficial for their patients. One of the things they wanted to know was, can we use naloxone to draw someone out of kratom withdrawal? And the one study that I looked at, Cheen from 2017, definitely found that naloxone administration does in fact force a person on high doses of kratom into withdrawal. And so this has been stated in several of the studies that I looked at. So people also are using kratom to combat symptoms of withdrawal from opioids, but the problem is that kratom itself causes its own withdrawals. These symptoms could be nausea, sweating, chills, muscle cramps, body aches, insomnia, fatigue, agitation, diarrhea, and anxiety. Just not a fun thing to be going through. Very uncomfortable. And so if a person were to start using kratom to mitigate these withdrawal effects, and then they start experiencing withdrawal effects from the kratom, I imagine that would be very frustrating. May even lead the person to go back and use the substance they were using originally, in which case that could also lead to a higher risk of overdose because maybe their tolerance has gone down and now they're going back and using the substance of preference, which could be fentanyl or heroin or other kinds of pain medications. So currently, there's no standard procedure for medical detoxification from kratom, although there's some evidence to support the use of naltrexone. Naltrexone is a medication used to alleviate cravings for alcohol and opioids. And there is a theory that you could use buprenorphine or methadone to treat kratom withdrawal in the same way that you could for opioid withdrawal. Other medications that you might consider for treating kratom would be similar to the ones they use in medical detoxes for opioids. And that would be things like phenobarbital, clonidine, Ativan, medications for nausea. Another population that may find it appealing to use kratom is people with a substance use disorder who are on probation or parole or possibly being monitored by a doctor. Kratom is not detected on standard drug screens. You have to get a special test to do a kratom. To get a level of kratom, you have to get a test from a lab. It's expensive. It's not something that's done in the office, in the probation office. It's not something that's done in going into a local agency and your standard 12-panel drug screen. It's not on there. This is appealing for people who want to be receiving services and maybe, Department of Social Services or from probation, and they still want to get high. So it is currently illegal to possess, use, or sell kratom in Alabama, Arkansas, Indiana, Tennessee, Vermont, Wisconsin, and in Thailand, Malaysia, and several European countries. But even in those places, kratom can be purchased over the internet, and it's easily accessible in places where it's banned. There's something that's been going on in Thailand for maximizing the effects of kratom. It's something known as a 4x100 cocktail. This is a mixture of kratom tea, soda with caffeine, codeine cough syrup, dextromethorphan, and diphenhydramine. This is a dangerous mixture of chemicals that is probably being used in the United States as well. All of these chemicals are readily available. Something that goes on that's also a substance of use in the United States is codeine cough syrup mixed into a thing of Sprite. Maybe they call it purple drank, scissor, all these things. So mixing something like kratom in with that is probably going on. The pharmacological effects of kratom, they have not been studied in humans enough to really understand the potential harms or the potential benefits of its use, and even less is known about how kratom interacts with other substances. So while kratom is said to have a high potential for abuse, some research has stated that it does have a lower abuse potential than conventional opioids. This is because even in high doses, a person using kratom in large amounts is probably not going to go into respiratory depression as they would with a traditional opioid. And so one study tried to figure out why that was. And they basically found that the way that kratom works on certain messenger pathways in the brain looks a little bit different, and that basically it does not severely depress respiration. Um, of course, this was a study done in rats, not humans, and so we really don't know that to be a fact. So we're just kind of on the fence. But is a person likely to have an overdose on kratom? Not really. It is possible. So an argument can be made that kratom produces euphoric effects and for those who have addictions to other substances, they would also become addicted to the kratom, which adds to the growing list of potential lethal pharmacological interactions that could happen in polysubstance users. Um, goes with cross addiction, and then there's always the possibility of triggering the user to return to their substance of preference. Um, so looking at kratom for potential benefits and harm reduction. Um, One thing to look at is that kratom is not an injectable substance. So there is that where you're not going to have the health risks associated with IV drug use. There's not going to be infections. You're not going to get sepsis. You're not going to transmit hepatitis C or HIV through using syringes. So there is a slight harm reduction in that way. The overdose is less likely, especially when you compare it to something like fentanyl. Smith, 2019 found that these kratom alkaloids, that some of them work very differently than other opioids. And for some reason, they split it up into different compounds. And so the 7-hydroxymitragynine is the alkaloid in kratom that's found to be more potent than morphine, but it still only acts as a partial agonist. And so that's why it's less likely to cause respiratory failure than morphine was, even though the effects of it could actually be stronger. So kratom use does vary across the United States. There are several biopsychosocial factors that are predictive of use. Um, NIDA has done several studies. The U.S. Department of Health and Human Services has done studies. Um, so, looking at a study done by Nice Wonder 2019, they found the most significant factors that were predictive of kratom use was level of education. They found that women were more likely to manage chronic pain than men through using kratom, but that men are more likely to use kratom in general, which is consistent with studies done by NIDA. Um, they're currently funding studies that largely sample self-report kratom users online. They find that they usually are male, they are employed, and they have a household income of $35,000 a year or more, and they usually have some college education. So, this NIDA study noted that adverse effects of kratom have been documented using data from poison control centers and that the number of reports are growing. So, they also explored available research on psychiatric effects associated with kratom, kratom fatalities, and neonatal abstinence syndrome in kratom users. So, one of the things about having a substance use disorder is that it comes with a lot of stigma, and people may be embarrassed. And so, people may want to use kratom because it's more socially acceptable than other drugs, kind of like alcohol or maybe marijuana in some cases. So, when a person is not seeking health care in general for their addiction or for anything else to take care of their health, that creates a lot of problems for the person and possibly for the community if the person is showing up in emergency rooms, things like that. So, the burden on public health is really high. Um, Looking at some functional limitations of having a substance use disorder, I looked at some things about addiction to alcohol. Alcohol is probably the most well documented substance to have adverse health effects that cause functional limitations and acute injuries. And so, while the effects of kratom are not documented in the functional limitations yet of that, you could infer that it would have the same things as other substances. So, there's that. Um, Another thing to consider is that people with kratom use may experience stigmatization from within the recovery community itself. 12-step programs are abstinence based. And so if they're coming into the rooms and they're using kratom, they may not be welcome to sponsor someone, or maybe their sponsor may tell them you're not really sober if you are using kratom. So these are usually conversations for the rooms, not really for the clinicians and the scientists, but what we can do is educate our clients. We can tell them that AA literature supports using outside help and resources such as psychiatry and doctors and medication, and that if they are encountering a group of people in the 12-step community that are telling them not to take their medications, then they should probably find another group to attend because that is not appropriate. However, I do think that people saying that kratom use is not a good idea is probably okay just because it's so unregulated and people really don't know what they're taking. So harm reduction is probably the most important clinical issues for counselors that work in addictions. We got to advocate for available harm reduction interventions. Um, so we know that kratom is probably a safer choice than, say, fentanyl, but there's just too little known about drug interactions, cardiovascular risk, psychological risk factors, and we virtually know nothing about the effects of kratom on an unborn fetus. So at this time, really can't recommend kratom as part of a clinical treatment plan, even in terms of harm reduction. Adding another substance to a polysubstance user is probably a really high risk, and that does come up with other medications that are used. However, these other medications are being prescribed by a doctor. They're being monitored in a clinic. So that's the main difference between kratom and some of the other medications like buprenorphine or methadone that are valid and researched and documented to be safe for use. I did take a look at a case study of an overdose of kratom. Um, this 2019 study gave a detailed account of a case report of a 36-year-old male who was found unresponsive at his home for an unknown period of time. EMS had administered Narcan to him, transported. He didn't wake up, incidentally. He was still unconscious. They get him to the emergency room, and he presented with a significant rating on the Glasgow Coma scale of 3. His heart rate was 130, his blood pressure was 80/40, and the man was put on a ventilator as his oxygen levels were extremely low. If you compared the description of this man's kratom overdose to a person in overdose from another type of opioid, the symptoms would be very similar. His family was unsure what he was using, but described to the doctors him consuming a green-colored herbal supplement to increase stamina. The man was put on intravenous norepinephrine, and he was given a lumbar puncture to rule out certain conditions. The only chemicals present in the man's system were found to be kratom alkaloids, with the 7-hydroxymitragynine levels at 500, which was enough to cause overdose. This is only one example of a kratom overdose, but documented by the FDA in 2018, there were actually 44 global fatalities involving kratom. And so they were not definitive that kratom was the only cause of death. However, kratom was a factor. And so this literature review has really only skimmed the surface of looking at possible benefits or risks of kratom use. The research is in its infancy stage, and kratom can have potential as a harm reduction tool that can save lives. But until there are human clinical trials, we really cannot determine if kratom can be used therapeutically. There has to be some type of federal regulation on kratom products, and it is not an ideal substance to recommend to clients who are using it for any reason. One researcher that I read that was actually most recent was from 2022, noticed that there's significant relevant gaps in information on kratom and called for more clinical trials, more research of people using it with cardiovascular disease and psychiatric disorders, substance use disorders, and drug interactions. And so appropriate research would then have cross-sectional longitudinal studies with large sample sizes, and going forward, that is not likely to happen anytime soon. So we need some legislation around that. And these are my references. And thank you for listening to my presentation on kratom.